Hi, good evening, and welcome back to these sessions on uh, how to answer the longest questions in anatomy. We have discussed a lot of important topics over the last 8 weeks, and this week we'll take up one very frequently asked question from the topic of or the section of abdomen and pelvis. Abdomen and pelvis, again, like we have few questions which very often get repeated. For example, duodenum, stomach, inguinal canal, then there is pancreas, and then there is uterus, then the uterine supports, right? These are like very frequently asked. If you check these previous year question papers, you will see these questions very often. So today I thought let's take a question from the section of abdomen and pelvis, and let's try and discuss how do we solve this. Remember, in the section of pelvis, when they ask about uterus, there are two longuices that can be asked from uterus anatomy. One is the anatomy of the uterus itself. The second one is anatomy of supports of the uterus, right? What we will discuss today is the anatomy of the uterus, and next week we will talk about the supports of the uterus. Both are very important longuices for your final exam. Done? So let's begin with the anatomy of the uterus today. This question was actually asked in the RGHS exam. If I remember correctly, 24 or 23 exam, right? This was the question. Now, even though this was asked for CBME, the question was like pretty straightforward. Describe the gross anatomy of the uterus. I've written it as it was asked, and then add a note on its clinical anatomy, right? So let's try and solve this. So when they ask question like this, which is vague, you need to be very careful in answering it. As I said, the thumb rule again, fix the time that you're not writing this for not more than 25 minutes. Okay, that's the upper limit because the question is non-specific and you can write pages together, right? So 25 minutes, keep the cutoff and start writing. The first thing you would want to do is start with the simple definition. Now, what is uterus? Uterus is a pear-shaped, right? It's a pear-shaped, thick, muscular, right? Thick, muscular, child-bearing organ located in pelvic cavity, right? Now, you may argue that uterus also extends into abdominal cavity, but what we are talking about is a non-pregnant uterus, which usually lies within the pelvic cavity, sandwiched between the urinary bladder in front, the rectum and the anal canal behind, right? This would be a simple definition. Then come to measurements, right? Now, what do we write in the measurements of the uterus? So start with the length of the uterus, right? Then the width, and then the thickness. Okay. Now this is quite easy to remember. All are in multiples of inches. For example, a non-gravid, when I say non-gravid, it is non-pregnant uterus. That's it. So length is about 7.5, width is about 5, and thickness is about 2.5. So 3 inches, 2 inches, 1 inches. Fine. This is how you can remember. This is the size. Now, a weight of non-gravid uterus is anywhere between 30 to 50 grams. Remember, uterus can grow up to a size of 60 to 70 centimeters close to term, right? When it holds the full term fetus. But a non-gravid uterus, a normal size non-gravid uterus measures about 7.5 centimeters in length, 5 centimeters in width, and 2.5 centimeter anteroposteriorly or thick, right? This is regarding the measurements. Now let's talk about the parts. What are the parts of the uterus? In order to understand the parts of the uterus, let's try and draw a simple diagram. This is the superior part of the uterus, which will form the fundus. Let's imagine this is how the uterus will look, right? Let's imagine these are the openings of the uterine tube, right? So this is the opening of the uterine tube. Done. Then here, let's imagine we have the lower part of the uterus, which is the cervix. And here, let's imagine this is the vagina. So the uterus is divided into an upper two-third and lower one-third. The upper two-third is referred to as the body. The lower two-third is referred to as the cervix. Right? When we talk about the body of the uterus, this has two surfaces, right? And then it has two borders. And it has a fundus. Now, what is the literal meaning of the fundus? Remember, the uterine cavity extends inside the uterus. Okay? And it does not extend into its upper part. So the part of the uterus into which the cavity of the uterus does not extend is called as the fundus. The rest of this will be called as the uterine cavity, which will become continuous with the cervical canal, which will ultimately open into the vagina. Done? So what are the two surfaces? There is an anterior surface and there is a posterior surface. So this is divided into anterior and posterior surface. The borders include right and left lateral borders. Done? What about the relations? We will learn about the relations of these surfaces in detail. Done? This is regarding the body. Now, what about the cervix? Remember, cervix has a part above the vagina and a part below the vagina. So above the vagina, we call it as the supra-vaginal part of the cervix, and this is called as the vaginal part of the cervix. As simple as that. Okay, this is regarding the parts of the uterus that we need to mention. Okay, mention it briefly with the help of a diagram, show it. This should be enough to show the parts. Again, I'm telling relations we will discuss separately. Done. So this is about subdivision and parts. Now, what about the normal position? As we mentioned in the beginning, the uterus is located in the pelvic cavity, right? Or the true pelvis, in between the bladder in front and the rectum and anal canal behind. Now, this is a simple diagram to draw. We will draw it in the relation. But what about the axis of the uterus? Two things here you must write as. One is the anti-version. Okay. So we have anti-version and then we have something called as anti-flexion. Now remember, these two will form the major supports of the uterus, which needs a mention. Examiner will always check whether you have written this or not. Right. So what do we mean by anti-version? Let's draw a simple diagram. So here we have the outline of, we'll just redo it again. So let's imagine this is the outline of the uterus and this is the outline of the cervix. And here we have the anterior vaginal wall and here we have the posterior vaginal wall. We will just copy this diagram as it is, right? Done. Now I'm copying it to explain the difference between antiversion and antiflexion. Done. Now, what do we mean by antiversion? Both are angles, correct? Both are angles which keep the uterus in its position and prevent it from prolapsing. Now, what do we mean by antiversion? In case of antiversion, what we have is we draw a line along the long axis of the cervix. Sorry, long axis of the vagina. Done. Now, what is the other line about? Done. The other line, remember, passes through what? The angle of the cervix. Right? So, angle of the long axis of the vagina with the long axis of the cervix, which is normally about 90 degrees. This is what we call as anteversion. So remember, whenever you use the term V, remember it as vagina. We will come back to this. What do we mean by anteflexion? Anteflexion is the angle between the long axis of the cervix and then the long axis of the body. And how about this angle? This is about 170 degree. In both, what is common? So remember, this is the angle between the long axis of cervix and long axis of vagina. What about anteflexion? This is the angle between the long axis of cervix and long axis of the body of the uterus. So which one is common here? Cervix is common. Cervix is common. In anteversion, remember it as V for V. V for vagina, version for vagina, right? So between cervix and vagina, anteversion. Between cervix and body, anteflexion. These two are very important. Even this could be asked as a 3-marker question or reasoning type of question. Question could be, anteversion and anteflexion prevent prolapse of the uterus. Is this statement true, justified? Yes, the statement is absolutely true. Anteversion and anteflexion both will prevent the prolapse of the uterus, right? Because anteversion and anteflexion ensures that the uterus actually rests on urinary bladder. It forms a good support and it prevents it from falling down, right? So anteversion and anteflexion, this is how you need to explain, right? Done. Good. Now, what about the relations? Now, this is a very important part where we need to explain what are the relations of the body, what are the relations of the cervix. So what we'll do is we will draw a diagram carefully and then try to explain all the relations. So let's imagine on this side, we will talk all the relations of the body. On this side, we will talk all the relations of the cervix. Let's draw the diagram again. So first what we'll do is we'll draw the outline of the urinary bladder. So let's imagine this is the urinary bladder. This is the pubic symphysis. This is the lower part of the anterior abdominal wall. So here, let's imagine this is the uterus, the cervix. This is the anterior vaginal wall. This is the posterior vaginal wall. And here we have the outline of the rectum and the anal canal. And let's imagine here we have the outline of the sacrum and the tip of the coccyx, anococcygeal raphe. Here we have the anti-abdominal wall. Now, what would be this section now? This is the sagittal section of the female pelvis, right? So here is urinary bladder, here is uterus, here is vagina, here is rectum. This is the anal canal. Done. Now let's draw the peritoneal covering over it. So peritoneum of the greater sac lines the superior surface of the urinary bladder, gets reflected on to the anterior surface of the uterus, then covers the posterior surface of the uterus, posterior vaginal wall, gets reflected over the upper 2/3 of the rectum. This is the peritoneum pouch or peritoneal relations. Now let's talk about the relations of the body. How do we study the relations of the body? Remember the relations of the body of the uterus, right? Anterior surface. Done. So anterior surface, let's begin with what is it related to? This is the anterior surface. Now what is it related to? Anterior surface rests on the superior surface of urinary bladder. So anterior surface, what is the relation? Superior surface of urinary bladder. What about the posterior surface? Now, if you closely observe, the posterior surface is related to what? The posterior surface is mainly related to a pouch. Now, what is this pouch? This pouch lies between the rectum and the uterine cavity. So what do we call it as? This will be referred to as the recto-uterine pouch of Douglas or pouch of Douglas, which is the most dependent part of female pelvic cavity where blood and other fluids can get collected. Right. So recto-uterine pouch would be ultimately filled with the coils of jejunum and ileum. So what is posterior surface related to? The recto-uterine pouch, which is filled with the jejunum and ileum coils. Did you get it? This is the relations of the body. Anterior surface, posterior surface. Now, what about the cervix? First, let's talk about the supravaginal part. Right? So, supravaginal part, again, what is related anteriorly and what is related posteriorly. Now, if you take a look at the supravaginal part, what is it related to? This is related again to the urinary bladder. But what surface? It is the posterior surface of urinary bladder. Did you understand why? Then, what about posterior relation? What is present posteriorly? Again, the recto-uterine pouch with ileum and jejunum. Remember, we are not talking about this part yet, which is the vaginal part. Then, what about the vaginal part? So remember, when we talk about the vaginal part, anteriorly, posteriorly, laterally. What is present anteriorly? Now, can you tell me what we will call this gap and this gap as? The gap between the cervix and the vaginal walls is what we refer to as fornix. So we can see an anterior fornix. We can see a posterior fornix. If we see the coronal section, what we will see? We will see lateral fornices, right? So what is the vaginal part of the cervix related to? If we go on writing, anterior, we have the anterior fornix. Posterior, we have the posterior fornix. And laterally, we have lateral fornices, which means there are two on either side. Are we clear? This is how we should mention the relations. Now, your question will be, why did I write lateral relation only for the vaginal part of the cervix? Why I did not talk about the body or the supravaginal part? Remember, the lateral border of the body and the supravaginal part will be related to two important structures. One is the tortuous uterine artery and the second one is the ureter. Right? These are the two important relations that are on either side, which are within a ligament called as the broad ligament of the uterus. Right? As I said, supports of the uterus and ligaments we will discuss in next week as a separate long essay. Hope this is clear. So we started with what? Definition. We then discussed about measurements. Then we talked about subdivision. Then we talked about normal position relations. Now, before we close, blood supply. Arterial supply, remember, is mainly from the uterine artery, which is a branch coming directly from abdominal. This is a direct branch coming from the internal iliac artery. Anterior division to be more specific. Apart from this, this will also be innervated by, supplied by vaginal artery, which is also a branch coming from internal iliac artery. If you want to be more specific, mention it as anterior division. Now, since like this is a long essay and arterial supply is a part of it, restrict yourself to writing uterine artery and vaginal artery. They come from internal iliac. There is no need to draw the diagram where you show the cross section of the uterus, show the arrangement of different plexus, how the blood vessels penetrate the myometrium and supply, not required here. Okay. What about venous drainage? Venous drainage, you can write it as the uterine veins and then the vaginal veins, which mainly drain into again the internal iliac veins. Done, nothing else. Then, what about lymphatic drainage? This would be a very important short note in itself. Lymphatic drainage of the uterus could be asked as a separate short essay or a 5-marker question. So this we will discuss a little bit in detail. How do we do this? Again, draw the outline of the uterus. A simple outline of the uterus showing, right, the body, right, the cervix, right, and let's imagine here is the vagina, right. Now, what I want you to add to this is the abdominal aorta. Okay, so we have the abdominal aorta. The abdominal aorta will split into two blood vessels, which are two common iliac arteries. The common iliac arteries will split into internal iliac and external iliac. So, abdominal aorta, external iliac, this is the common iliac, and this is the internal iliac. Now, the lymphatic drainage from upper part of the body. Okay, where does the upper part of the body drain into? The upper part of the body drains its lymphatics into two lymph nodes. One is located right here, and one is located right here on either side of the aorta. Right? So what exactly are these lymph nodes? This is para-aortic. And what about this? This is pre-aortic. This looks a complicated diagram, but once you start drawing it, it's very simple. So upper part, where is it going? Pre-aortic and para-aortic. Where is the middle part going? Remember, the middle part, this actually goes into this group of lymph nodes, which are located along the external iliac vessels. So what will you call these as? You will call these as the external iliac nodes. Done. What about the cervix? Cervix is very peculiar. Cervix will drain into internal iliac. Okay. Then cervix will also drain into external iliac. Cervix will also drain into the obturator nodes as well. Done. Apart from this, where we have this intramural portion of the uterine tube, this is very peculiar. This drains into superficial inguinal lymph nodes. So of all the things that we discussed, this is very peculiar, right? So the end of the uterus where the uterine tube open, they actually drain into superficial inguinal nodes, which are basically the lymph nodes draining the lower part of the anterior abdominal wall and the lower limb. Whereas the rest of the entire uterus drains its lymph either into pre and para-aortic or external and internal iliac or obturator nodes. This diagram could be a lifesaver for your exam. Fine. Lymphatic drainage of the uterus. The last thing, okay, they can ask you about the nerve supply. Nerve supply for any viscera, abdominal or pelvic, you will discuss under two headings: sympathetic, parasympathetic. All you need to write is sympathetic is from T12 to L2 nerve roots, and this is from S2 to S4 nerve roots. That's it, nothing else. Fine. This is regarding nerve supply. And end it with applied anatomy. Okay. In applied anatomy, the one you can always talk about is the prolapse of the uterus. What do we mean by prolapse of the uterus? When supports of the uterus or ligaments of the uterus fail, the uterus descends out of the vagina. This is what we call as prolapse of the uterus. Done. The next thing you can write is talk about the fibroid. Okay. Fibroids are benign tumors of the uterus, which can occur in the myometrium or perimetrium. Right? Then you can talk about few of the congenital abnormalities like the septate uterus. Then we have the bicornuate uterus, right? All this could be written as the congenital abnormalities. Done? Are we clear? Now, this is how we are supposed to write if the uterus comes as a 10 marker question or a long essay. Now, remember here, they did not ask about ligaments or support. So we have not touched it. But we will take up this as a separate topic and we will discuss through this thoroughly. Fine. If there are any doubts related to whatever we have discussed till now, you can ask, or else we will close the session here. And Thursday, we will come back with the slides of the small intestine, duodenum, jejunum, and ileum. Next week, we will be talking about the long essay on the supports of the uterus and the ligaments of the uterus. Any doubts? Please feel free to ask. Right. If there are no doubts, what we'll do is we'll meet again on Thursday to discuss the slides of the 3 slides of small intestine, duodenum, jejunum, and ileum.